All right, everybody, we're going to go ahead and get started. Welcome, everyone, to our last PCOH meeting for the year. I am Helen Hockey, and I'm the director of the coalition. I have our board president, Jenny Engelers, joining us as well today. And I'll let Jenny turn her own camera on so that, there we go. Hi, Jenny.
Good afternoon.
All right, so as we move forward through today's meeting, just a couple quick announcements. We have about 55 people registered for today's meeting, so that's wonderful. Thank you guys so much again for taking your time to learn more about the coalition and the work we've been doing. Everyone is muted as they join the line, so if you're trying to say something and can't, that is why. It helps a lot with background noise, particularly when you have so many people on the line. So if you do have any questions or concerns, you can use the chat function within the black bar on the screen there. And if you want to submit a question, you can use the Q&A feature. There should be a little Q&A box on your screen, and you can type your questions into that, and we'll be alerted that there's a question pending. Some of the questions we may get to at the end, and some we'll answer, as we go through the slides today. So our goals for today, we want to talk about our 2017 accomplishments, the work that has been going on for the last few months, and looking ahead to 2018, some of the initiatives and the plans that we have for next year. We'll go over some upcoming dates, meeting dates for 2018. And I would like to bring up a poll here to see, it's always good to have a good idea of how many people have joined us in the past, either for a live meeting or a virtual meeting, or both. So please, if you can, if you're joining us by computer, if you can answer the poll in front of you now, and we'll just get an idea of how many people have been involved and to the level of involvement that you've had. So, and we'll give about 10 more seconds there for anyone who's still answering that poll, and then Holly will bring up the results so we can just have a good idea of who's on the call. And okay. So it looks like the majority of you are old friends. So at least between those who have attended at least one type of our meeting, we're at 96%, which is pretty amazing. So thank you so much again for coming back. So as we move forward through the slides, just to take a moment and thank our corporate and foundation sponsors. Without them, we could not do the work that we do. And also to give a shout out to our stakeholders as well, who donate their time and resources and money, giving selflessly to this work. I'm just totally blown away all the time by the people who are willing to chip in for this. And so just a reminder that you are all our most valuable assets. So thank you very much. Before we move on to some of the work and the priorities for anyone who might be joining us either for a first time or they're newer to the coalition, we'd just like to give a little bit of brief background on our partnership with the Pennsylvania Oral Health Collective Impact Initiative. So it's a group partnership across the state, and we partner with the Pennsylvania Association of Community Health Centers, the Pennsylvania Head Start Association, and the American Academy of Pediatrics Healthy Teeth, Healthy Children program. And I did want to say, for anyone who's joining us by phone only, we will be sending the slides out after the call. So if you're not able to see the slides and you do want to check those out, we will be sending those out. So our partnership with the Collective Impact Initiative, it's really a pretty amazing thing. We've got the groups doing all kinds of work, a lot of work surrounding the education of workforce and medical and dental personnel. So, the PAC group does a lot of work with our federally qualified health centers. And those centers serve 1 in 17 Pennsylvanians. So it definitely has the direct impact on the citizens of the Commonwealth. We've got the Pennsylvania Head Start Association that does tons of continuing education programs. So we're training providers on seeing kids at age 1. We're teaching ways to educate children, both in the classroom and in the office, teaching community health workers about oral health. And we have a newly developed special needs program, which has been very popular towards the end of this year. And then our folks at the AAP have a couple different things. They are training primary care providers about fluoride varnish and how to apply, and also informing obstetricians on oral health care needs for pregnant women. And they have an oral health story kit program where we're distributing materials to libraries across the state to share with children and adults as well during story time. So just had to give a little call out for them. Moving on, and Jenny, I don't know if you're going to pop back on here to talk a little bit about our priorities.
Yes, I'm glad to represent the board. My name is Jenny Englert, and I'm sending you greetings from York, Pennsylvania, from my health center, Family First Health. And I've been so pleased to be involved with PCOH for a number of years, a variety of different activities, and currently serving as the board chair. What I wanted to just take a moment and share with the group is, and really a reminder for those of you who have been around for a while, what our 4 priority areas of work are as a coalition. And these were reaffirmed by our board in a recent planning retreat where we got together in November. And under each of these, supporting the workforce, improving oral health of the most vulnerable populations, advancing implementation of the oral health plan, and advocating for community water fluoridation, each have a variety of activities included under each one of those. And you'll hear more about some of those today in particular, but these are the places that we're looking for folks to plug into our work, be able to contribute, and help us in general advance the mission of our statewide coalition. So lots of activities have been going on in each of these areas and lots of great things planned for 2018. So I'll turn it back to Helen to give us more details on each of these. But before I do that, I want to just take a minute to thank our board members and really all of you that have been active in the coalition in the past year. We've done, as a board, work along with Helen and the rest of the team, the staff team for PCOH, in building infrastructure and helping convert the coalition to a full-fledged 501c3 organization. And it's really been an exciting time for the organization and one of great advancement. And we couldn't have done it without the help of, as I said, board members and really all of you that have been supporting our work, many of you for a number of years as we've made this transition. So thank you all. I'm really grateful to work with such a great group of people.
I second that. Okay, so as we start to talk more about the priorities and the work that's been done under those, just a quick poll. How many of you were able to attend our Oral Health Workforce Innovation Summit in November of 2016? We're going to just get a brief idea of how many of those on the call today were able to do that. So as we leave that up for a minute, just some brief background for maybe those who weren't there. We gathered over 120 stakeholders from all across the state and some outside of the state to look at our workforce issues, start brainstorming new possibilities, how the direction that we see Pennsylvania heading in, possible solutions. And if you did miss it, all of the presenter videos as well as the summary video are up on our YouTube page. So you can actually go and check those out at any time, which is pretty fantastic. And I'm seeing that we have the poll results up. So about 60% were in attendance and 40% were not able to join us then. So that's pretty good. What I was hoping to see was a continuation of that work, so that for those who were able to attend, they're still hanging in, they're still engaged in the work. So that's great. And I invite you, if you were unable to attend, that, go and check out our YouTube channel, and you can actually, learn a lot about what was kind of discovered at that conference. So as we move forward with that, what our plans for 2017, we looked at some of the, these are just kind of a handful of the ideas that came out of the event. The groups, in particular within these workforce prototypes that were developed, have been really working hard, really gaining a lot of traction with these pilots. And we really wanted to kind of track this and see the best areas for, replication of the efforts. So when we see one of the things that we hear a lot about right now, teledentistry is just, it's a hot topic. It's something that I am hearing about all the time. And so, just as one example, we were able to pilot a small program and just try to kind of work out the logistics of how teledentistry could work in a program such as Head Start. And so that's one of the prototypes that, came out of the conference. We've got a ton there. And so what our plan is that in the next couple weeks, we will have a 1-year kind of report out on all of the different workforce prototypes that were developed at the summit, and what they look like now, and then what they could do in the future. So as we move ahead here, so again, that workforce report will be out. I would expect that you'll be able to find that on our website. Hopefully late December, we'll say maybe early January. And I thank everyone who's been supportive of that and helping us get all the information. We want to use that report, in a variety of ways. We want to take a look at the bigger picture of our state health, but also fine-tune some of the programs that have shown some promise and kind of develop how we can replicate those. And we're going to be doing a little bit of a deeper dive into the state workforce issues. We're very fortunate to get some assistance through Temple and the use of one of their dental public health students. So we're going to start looking. We had a little bit of discussion at the summit in regards to looking at our workforce and, whether we have a shortage of providers or whether it's a distribution issue. And, we kind of started that conversation, and we know that we have enough providers in the state when we look at numbers, but, are they accepting the right insurances to serve the underserved? Or are they still accepting new patients? Or do they see patients under a certain age? And so when we start asking those questions, it maybe will give us a better picture of what our workforce really looks like, and that's something that we're looking to do into 2018. So stay tuned for some more info on that. And then, after a lot of conversation around the needs of our stakeholders, we've decided, and of course everyone's been very supportive, to hold a recurring biennial summit focusing on oral health, and we'll have some conversation on workforce in there, as well as, other important oral health issues in our state, talking a little bit about how we're accomplishing the goals of the state oral health plan, which we'll talk a little bit about in a few minutes here, and to kind of just have a nice regular convening of the stakeholders where people can kind of depend on that being a regular thing. So please save the date. For 2018, the summit will take place November 29th and 30th, so mark your calendars now. If you're sitting at your desk, it's a perfect time, jot it down. And then we will welcome any input from our stakeholders as part of the planning process moving ahead. So feel free to reach out if you have anything to say about that. So when we look at our next priority and we start talking about improving the oral health of Pennsylvania's most vulnerable populations, we have a lot of factors in play on this. As a bit of a background, medical assistants, for those who may not know, used to have a comprehensive dental benefit for adults, and it was cut in 2011 to just basic benefits. It was done as a result of just a budget, restraint, trying to trim where they could trim. And so, we know that it's a priority to get those benefits restored back to a level of comprehensive benefits. But we also have to keep in mind that, Pennsylvania has a current benefit that's better than a lot of states. And we don't want to jeopardize that. So it's really important that we think very thoroughly about how we approach this. We know that, adults in Pennsylvania are turning to emergency rooms and emergency departments for dental care and treatment of their infections. And, we'd like to take a real broad look at that as part of the process here. So this year, what we focused on was promoting the need, the growing need that we know is there, while being mindful of the fact that we have to protect the benefits that our citizens have now. We have a core team looking at this, and we're utilizing a lot of different groups like Put People First and FAN, which is PA Health Access Network, Achieva, Berks County Community Foundation. We've got a lot of groups kind of working on some of these things, and we're very fortunate the DentaQuest Foundation has also offered additional help from a group called Community Catalyst. So we're kind of taking a step back, looking at a very thoughtful approach to how we can move forward in 2018 and hopefully get some of those benefits restored. So some of the other things that we're doing in terms of improving our access, we did a wonderful partnership with the Free Clinic Association of Pennsylvania this year. And we know that of the 63 or so free and charitable clinics in PA, less than a third of those clinics are offering dental services. So, it's a perfect opportunity for, a place where people are gathering for medical care to maybe start getting some dental care as well. So we held a meeting in September to kind of strengthen that collaboration. And then we were fortunate enough to be able to distribute some resource binders focusing on oral health to all of the 63 free and charitable clinics in the state. So that has been a pretty amazing partnership, and we're looking forward to kind of continuing that into 2018. We're also very fortunate to receive the benefits of a block grant that the Department of Health had, and we were able to do a statewide television and internet commercial campaign, mostly focusing on, one, the importance of healthcare in pregnancy, oral healthcare in pregnancy, and then two, driving patients who are pregnant to the dentist to seek that care, particularly the ones that are more underserved. So as part of that, we had 2 separate TV commercials and an internet 15-second clip commercial that were kind of pushed out there. And we were able to kind of tag team that with some resources, some flyers and magnets and spoons and things that we distributed out. We took a list at all of the obstetrician offices that had more than 50 deliveries billed to medical assistants in 2016 and targeted all of them that have more than 50 deliveries within the office. So we're hoping that it was a very targeted approach to reach the populations that we were looking for. And we had materials we had 25,000 flyers in English and Spanish and 25,000 magnets that went out to these offices. So it's a really nice education piece that we were able to do. And many of you, I'm going to go forward here and show you guys, in case anyone hasn't seen one of the commercials, I'm going to take 30 seconds here and show you guys that so that you can check it out.
Good oral health is an important part of a healthy pregnancy. Oral health problems like tooth decay can worsen during pregnancy if they aren't treated. Likewise, hormonal changes may increase your chances of developing gum disease. Many Medicaid programs include dental benefits for pregnant women. To find out if your Medicaid program covers dental visits during pregnancy, contact your local Medicaid office. Make oral health a priority in your pregnancy by scheduling a dental appointment today.
So just a quick poll then, for those who are joining us on the computer, if you can let us know if you've seen one of those commercials in your local market, that would be great. We were able to target areas based on, the health districts, and we tried to focus in the areas where we know that health was suffering the most. So there were a handful of areas that might have only seen them on the internet. They might not have had the TV and the broadcast, cable and broadcast commercials. So, and it looks like we were at 17% having seen them, so that's great. It was a campaign that ran for about 2 months. So, you know, we're hopeful that if we, you know, we might get that same kind of opportunity in the future, that we could do a similar thing. So, and we've heard some great feedback, both from people who've seen the commercials and then also the obstetrician offices that received the materials. We've heard back from groups that have seen them handed out at hospitals and things like that already. So that was all done just from September to the end of November. So pretty amazing. So try not to start my commercial over again. There we go. So the question is, we focus a lot on kids when we talk about most vulnerable populations, and so are we making a difference? And we were fortunate with our work with the Pennsylvania Oral Health Collective Impact Initiative to get some of these numbers from the Department of Human Services. We know that, so when we're looking at the last 5 years and we're talking about kids getting, you know, preventive dental services, we know that in the last 5 years we have almost a 35% increase in the kids who've had those services, which I think is just phenomenal, pretty fantastic. And the in terms of the second bullet point there, when we're talking about in the last year, pretty amazing that we've seen an 8% increase just in the last year. Now, those are unofficial numbers using data that's not completely published yet, but we know that the numbers are still rising. So, and I actually was on a call this morning, and some of you probably were on that call as well, with the SHIP program, which is the State Health Improvement Plan. And, you know, one of the things that we were looking at was even just in the last 2 years, our goal for all Medicaid eligible kids under 21 was to, you know, move from the 42.5% having a visit in the last year. And our goal was to hit 47% by 2020, and we're already at 45.05%. So, you know, going up 2.5% and that's older kids as well. So seeing that increase in just the last 2 years, I think is pretty heartwarming. So we'll hope to continue that moving forward. And let's see here. So as we look ahead then from that data, so what are we going to do next year? Again, continuing that partnership with the Free Clinic Association, making sure that for the folks who depend on free and charitable clinics, that we can offer some oral health resources. And there's a variety of things that can be done there. It doesn't necessarily mean that they have to open up an oral health clinic. It could just be more direct warm handoffs. It could be partnering with local facilities that do offer dental services and maybe, you know, trying to be able to do appointment setups or educational programs within there. And then also assisting these free clinics with getting volunteers, because they need volunteers. So for those who are on the line that are dental providers, it's a great use of your time. It truly is. And so I would invite you to reach out to some of those clinics if you haven't already, and see where you might be able to be of use there. So we're also going to look at the media campaign. Obviously, with it running so late in the year, we haven't really had a chance to analyze the information that's come out of that. So we'll be able to evaluate that for effectiveness, and hopefully see where we could use that information moving forward. And then, you know, within our advocacy group for the adult dental benefit, we really are taking a kind of a broad approach. I want to say that, you know, we've kind of come up with something that we think can be successful by, you know, looking at the different moving parts. And so really identifying oral health champions within Harrisburg. You know, I would say historically, we've had a handful that have popped up here and there, but making sure that, you know, we look on all sides to identify people that could really put oral health as a priority for themselves and their constituents. You know, and we will probably be reaching out with some folks moving forward on that. Feel free, if you know of any of your local representatives that do focus on, health, and, that you think that you might have an oral health issue in your district that could be important to them, please do let us know that. We're also going to look at numbers because, when in an area and a time when we do everything sometimes by what the numbers show, we've got to be able to look and see that, when the benefits were cut in 2011, did we save money? Did it really save money, or did we just cause people to not get disease treated and cause more expense? So we're going to look a little bit at that. And then, we're working very closely with the folks at Achieva to look at the benefit limit exceptions, which are, the exceptions that the managed care organizations can grant in order to allow for additional services not regularly covered under the plan. So, maybe there's a way to put back some of that information and make it a little easier for folks to be able to get that. So, on to the next priority here when we're talking about the Pennsylvania State Oral Health Plan. We've been saying it for a bit, but it is in the final draft is within the Department of Health right now, so we're hoping that that's going to be coming out very, very soon. As soon as it does, PCOH will be distributing that final version to all of our stakeholders. I'm sure most of you on the call have been getting our regular updates, and if you haven't, you will start. So we'll make sure to get that out to everyone as soon as we have it. I think most of our stakeholders were able to review the draft and make their comments during that time period. So now we start to look forward and we start to think about how we're going to evaluate the effectiveness of the plan, and how we can look at how it's moving forward. So for those who might not be super familiar with the priorities within the plan, it basically boils down to three things. We're talking about access, we're talking about workforce, and we're talking about infrastructure. So the access is more of your prevention and education piece. The workforce is, talking about how to utilize everyone to their fullest potential, getting the providers in the right areas for the right populations. And then infrastructure, just making sure that we have the capacity within our own state government to support everything, to not only have the right staff in the department, but then also to look at how we're collecting the data and how we're using that. A regular oral health surveillance system is definitely needed, and that's going to be a focus, I'm sure, with the department. So, those are the main goals of that. So when we look into next year, what will that look like? The coalition will be assisting, of course, with the implementation of the objectives. We'll be assisting with holding some regular meetings and getting the right people to the table, and then also keeping everyone apprised of the progress within the plan. Something that many of you have heard about at some of our meetings is the Live Healthy PA website, which right now is being used for oral health specific kind of highlights, I guess, so that you can log on there and see initiatives that are happening around the state. The goal is that there is a kind of a back-end platform within that site, and we would be able to kind of use that within the Department of Health to organize our work groups. So that, some of the people that are doing things that are more pertinent to the objectives of the plan could have a place to gather and share ideas and kind of work forward. So kind of keep your eyes peeled for that as we move forward. The other thing is that we, know that there will be some HRSA, there's a HRSA dental workforce and CDC capacity building grant that will those are two separate grants that we are expecting will be announced here in the next month or so. So we're keeping an eye on that along with the Department of Health so that we can assist the state with, any applications for those grants so that we can continue to get the funding to move us forward. So really important stuff for that. And our last priority, talking about community water fluoridation. So as you can see, the the ranking of Pennsylvania is not so great in terms of the percentage of our folks on community water supplies that get fluoride in their water. But what we were able to do is we had a lot of work going on in 2017 for this, but we just were able to publish our brief and infographic, which you'll see on the screen here. And so we're hoping to be able to distribute that information to the folks who need to see it and continue to move that work forward. Now, this brief is available on our website, so if you go there, you're able to download it for use if you need it. Our 2017 issue areas really focused on Meadville back in, well, the whole first half of 2017, Meadville was an area of concern for fluoride, and we were very fortunate that they did decide to add fluoride to the water in an area that was previously unfluoridated, so that was a great win. Johnstown, not so much. That's the water authority there had decided to discontinue fluoride, and it was kind of something that it hasn't happened yet. They're still in the process of submitting the permit and application to the DEP to discontinue the fluoridation. So I'm still hopeful that we can maybe make some efforts in the other direction for that. And Ebensburg was an interesting one. Ebensburg is a little town in southwest PA, about an hour plus east of Pittsburgh. And they receive a portion of their water supply from Johnstown. So their thought process was that if Johnstown was going to discontinue fluoride, that they should as well, even though it doesn't make up a large percentage of their water supply. So we're very, very happy to go and attend a meeting there in about a month ago and speak to the board along with some great support from PDA and some of the local dentists. And they did decide to rescind the motion to remove the fluoride. So it's still being talked about. It's still a topic of conversation, but for now, Ebensburg will continue fluoridating. So that was a great success. And some of you probably serve on our community water fluoridation team. We have a pretty good group now of about a dozen professionals who know the ins and outs of community water fluoridation. So if you are hearing any buzzing in your community and you need a little bit of help, we can probably find you a resource that's local to you to help with that and give testimony at any meetings or anything like that. So looking into next year, one of the things that we really want to focus on is collaborating with the Department of Environmental Protection, trying to kind of make those connections to see if we can start structuring the way that, or maybe looking at the structure of how people are informed when the fluoride is going to be added to or taken out of their water. The other thing is, you know, we have regions of water authorities in our state, and we'd like to kind of make direct connections to all of those so that we can start educating the water authorities. It seems like sometimes public opinion is a little, I'll say, harder to sway. And so, if we can kind of get the folks in charge of making those decisions on board and supporting community water fluoridation, we may be able to see a turnaround in the percentage of our communities that are fluoridated. And of course, we're going to get the brief out and distribute it as widely as possible to use that in our conversations, both with the general public, with the water authorities, with the legislators, to try to get that information out there that community water fluoridation is a safe and effective way to reduce decay. And then, we'll also be putting a lot of materials up on our website in promotion of community water fluoridation. So if you're looking for resources, I would say by late January, we should have a pretty meaty piece up there for you to use at your discretion. So what else are we looking at as we're moving forward? I mentioned adding the community water fluoridation information to the website. Along with that, we're looking to, we should be having a little bit of an updated website coming out here in the next couple weeks or so, just to kind of streamline what information is on there, add some resources, maybe make it a little bit more user-friendly. So if anyone's gone to our website and been a little bit confused, hopefully we'll clean that up for you a bit. And our membership transition to stakeholders. So in the past, PCOH kind of we had a membership component, and then we kind of had a non-voting membership component. And now we'd really like to make the transition to stakeholders. And what that means is that in the past, members had paid memberships. And, you know, we would love to see a situation where we can recognize all of the people who give their time and their assets to the coalition as stakeholders, but not necessarily require that there's a membership fee to join the coalition along with that. So what you can do now and what you'll see is that, you know, we have on our website, there's a Get Involved link. And within that, it talks about how you can serve as a stakeholder, make a donation if you're able to. That's great. That helps us continue to do our work in other ways. And, you know, join our mailing list, which you can share that information and kind of see other ways to be involved with our work. So more of just semantics of saying stakeholders versus members. But I think that it's a good move in the conversation. So, and with that in mind, what I'd also like to do in 2018 is establish a stakeholder spotlight, because we have so many amazing people doing so many amazing things. I would love to be able to kind of recognize that through our website and our social media outlets, so that everyone can be more aware of the important programs that are happening. So we'll be setting up a framework for that in the coming weeks. And hopefully if there's someone or a program or an individual in your community that you want to recognize for doing great oral health work, then you'll be able to do that. So that should be fantastic. We do have an overview brief on our site from 2014 that we will be getting updated and be putting out, you know, in the early parts of 2018. So you can look for that on our website as well. We were able to do a press release this past week, totally community facing. So just kind of more of a fun project to get some oral health information out to general people. And what was amazing is that, you know, we had a pickup of over 250 outlets, and the numbers that they're giving me is that, you know, there was a possibility of 84 million people seeing it, which is pretty fantastic when we're talking about oral health and spreading the word. So we'll be putting some more of those out into 2018, so that's great. We were able to submit an article for the PDA Journal on the coalition and the work that we do, so we're very grateful for that. And then as we look into 2018, we're going to be looking at identifying the local oral health groups that are already out there, local and regional groups, to try to make some connections between those and kind of offer our support as needed to make them as strong as they possibly can be. So that's kind of the update of what we're looking at in the coming year here. Our meeting schedule, you'll see, is also posted on our website as well. So if you look at the events and calendar page, you'll see all of the 2018 PCOH meetings are listed there. We will probably be having 2 of the virtual meetings again, so we'll be putting those dates up as we decide them. But please try to attend one of our all-day in-person stakeholder meetings. There's a lot of information we go through there, and it's a great way to meet a lot of people too. The networking piece really can't be discounted. It's fantastic, and I'm always amazed, even when I come out of the meetings, you know, that we're able to put this person and this person in contact and start making those connections, which is really great. And other ways, if you're not following us and all these different varieties of ways, please do. When you get your slides after today's meeting, the links to the different groups here will all be working links so that if you're not liking us on Facebook, following us on YouTube or Twitter, or donating through Amazon Smile, please feel free to go ahead and set those all up. And we have our listserv as well, which was something that came out of our Workforce Summit. Not used quite as heavily as our regular updates, but it's a great way. We've got over 120 members on the listserv now. So if you have a question that you want to put out there to the oral health community, it's a really great way to kind of get it out there quickly to anyone who can help you. And of course, we'd be remiss if we didn't mention the Mission of Mercies coming up in 2018. So the dates are there. We've got the Mission of Mercy in Pennsylvania that'll be in Reading in May. And then Mission of Mercy in Pittsburgh, which they started last year and they're going to be continuing with, will be late July in Pittsburgh. So some really great opportunities that if you haven't had a chance to be a part of yet, we need dental professionals to volunteer, but we also need health professionals and lay volunteers as well. So hundreds and hundreds of volunteers needed. So you can do it as a family event and bring your spouses, partners, and friends and make sure that everybody kind of gets on board with that, helping oral health in Pennsylvania. So at that time, Jenny, do you have anything you want to add before we go through any questions or anything?
No, I think we've really covered the waterfront. I think it's been a great review of the year and ability for everyone to look forward. I think it was, you posted the calendar for next year. I'd really encourage people to pick a meeting or two that they're able to attend. We had great attendance through the year, 30 to 40 at each of our meetings. And this past year was the first year where we kind of spread out around the state. And I think we had great response from that and are going to replicate that again this year along with the summit. So I know we were able to answer a couple of questions or respond to some comments as you were going through the slides, but I'd welcome any additional comments or questions.
And I did want to say the one of the questions from our AGD friends was talking about putting some materials within the food banks, and I think that that's a really great idea. Something that in my mind hasn't crossed my sight before, but I think that we could certainly do a lot with that. So you know, just putting that out there. That I think it's a great idea. So things like that are always good because there's always opportunities when, you know, we might be able to offer services, resources, and whatnot, sometimes just in an advisory capacity, but sometimes in a physical capacity as well. So, you know, if folks have ideas of places, you know, where we can try to make connections and start getting more oral health information out there, that's wonderful. So, any other questions at this time? Okay, guys. I don't hear any crickets chirping, but I don't see any questions. So I'm going to assume that means that you'll email or contact us if you do have any that you weren't able to say today, or maybe you called in on the phone and so you weren't able to type into the computer there. But we will gladly give you 15 minutes of your day back. And we will have the recording of this webinar up on our YouTube channel as well. So if you need to kind of go back through and see any bits of it, you've got them. So with that, thank you guys very, very much. Any last wise words there, Jenny?
I don't know if they're wise, but I wish everyone the best of the season and really looking forward to accomplishing great things collectively around the improvement of oral health in Pennsylvania with all of you in 2018.
Ditto. Thank you, Jenny, and hope everybody has a wonderful remainder of the year. So thanks so much for joining us.
Thanks.